Hi everybody, I'm Dr. Amir Karam, board certified facial plastic surgeon, the founder of Karam MD Skin, and I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna help understand a topic that comes up a lot, and I get asked about this all the time. And it's, Doc, what do I need to do? Do I need a laser? Or do I need injectables? Or do I need both? Like, what's going on? Or can I do one versus the other? So I'm gonna help clarify this very, very important and interesting topic and give you the tools so that you can navigate and understand exactly what's right for you by knowing what each of these modalities will do for you. Additionally, we're gonna talk about what conditions these particular two treatments, lasers and injectables, don't treat, which is equally as important as what they actually do treat. And ultimately, we want to start with the basics. So I'm going to give you the foundation of what you need to be doing if you're on this road of non-surgical anti-aging, what you can do as a starting point, which will pay huge dividends in the long run. So without further ado, let's break it down. Lasers versus injectables. People use those two terms interchangeably as if they're the same thing, and they're not. And different categories of injectables are also not. And we're gonna break it down and really clarify very cleanly what each of these things are. So basically, this is what it comes down to. Lasers are a treatment that are used principally and effectively to improve certain conditions of the skin. What do they address? It addresses, brown spots of the skin, red spots of the skin. They address dullness, that addresses fine lines and wrinkles, especially those around the mouth. But those are conditions related specifically to the surface of the skin. So when you think of laser, I want you to think of conditions and changes that are happening to the surface of my skin. But I also want to put this seed in here, and I'm going to get to this full circle at the very end of it. Lasers are not the treatment for the skin. In fact, they are not the only thing you should be thinking about when you're thinking about good skin, but in general, I want you to think lasers equals skin and nothing else. All right, so let's walk over to the injectable side of the category here. So injectables are viewed again under one umbrella as if they all encompass everything and everything being the same thing. But injectables are very distinct in terms of what they address. In that category, common terms that are used are Botox and fillers. Botox and fillers do very different things. So I want you to understand that Botox and fillers are not interchangeable and they're not the same. However, they are under the injectable category. So let's break down for a second what these are. So Botox is a brand name for a neuromodulator that decreases the impact and strength of the muscles around the face. So specifically, it's used to treat the upper face. So lines that form between our brows that are called the 11s, the crow's feet that happen from smile lines, and the upper forehead lines that happen as we raise our brows. Botox is used to dampen the effect of the muscle on the skin and also prevent that line from going from a dynamic, meaning that it's only there when you're moving, to eventually becoming a static line that it's there even when you're not moving. So that's the preventative effect of Botox. And then the treatment aspect of it is that it decreases the magnitude or the depth of those lines when they're being treated at the time. But that is specifically for the lines around the upper third of the face. Fillers, on the other hand, are used to augment or replace lost volume, because one of the important parts of facial aging is that we lose facial volume and we lose it kind of throughout our whole face. So fillers are a tool that are used ideally just to replace some of that lost volume. That is a very important distinguishing factor from lasers as well as Botox, that they're not the same. So what areas are commonly used for fillers? They're used for the lip augmentation, they're used for filling in the temples, upper nasolabial folds, around the mouth, fine lines and creases here and there. But keep in mind that fillers, although they are in the injectable category, they are not used to elevate or lift the face. So don't think of it as a non-surgical way of addressing a facelift. Okay, that's a very important point that we'll dive into a little bit deeper. So basically, fillers, augmentation, Botox, reduction in magnitude of muscle contraction, and then lasers are used for the overall treatment of improving the quality of the skin. So how do you know which one you need and at one point? Let's step back for a second and let's just understand the facial aging process. So there are three categories of changes that are happening with facial aging. Number one is changes that are happening to the quality of the skin. The other one is volume loss, and the third thing is facial laxity. Now, facial laxity is what happens when the face gets longer, you start to get jowls, you start to see sagging of the neck, all these things that are typically happening around the late 40s and early 50s. This is the thing that changes the shape of the face and makes people really look like they have a different identity. They don't look like they relate to themselves anymore. That is changes associated with laxity. There's nothing you can do to avoid that change from happening. It's genetic, it's just normal sort of aging. But the treatment is very different than what we just talked about. Treatment of laxity is reserved for the surgical modalities. And in my practice, I do the vertical restore, and I've talked a lot about this on this channel. It's just basically my approach, a more up-to-date and a much more natural looking way of addressing a facelift, basically, but without confusing it with a standard facelift, which is not as natural looking or not natural at all looking relative to the results we see with the vertical restore. But know this, the lasers versus injectable sort of decision has nothing to do with laxity. And if you try to address laxity with lasers or fillers, you're in for a rude awakening, and you're gonna go down a road that's gonna cost you a lot of time, money, and energy, and ultimately probably leave you looking pretty deformed. And if you go down that road with lasers, it's probably gonna leave you going through a lot of recovery and a lot of downtime for nothing. I mean, nothing's gonna address the changes. All right, so let's quickly summarize what lasers are ideal for, what conditions, what fillers are ideal for, and then that'll give you a little bit more understanding. So basically it comes down to this. If you have brown spots, red spots, dullness of the skin, fine lines and wrinkles, lasers. If you have lines that are forming around the upper part of your face, the 11s, the forehead lines, the crow's feet, Botox. If you have mild volume loss that you're seeing, that your face is starting to look a little bit hollow, a little bit of volume into those areas with fillers, beautiful approach. But remember, one little caveat, one little pearl, use it in a balanced way. Put a little bit in a lot of different areas. Don't put it all in your cheeks or all in your lips, because you're gonna lose proportion. You're gonna start looking like a blowfish, and you're not gonna like the way you look, and people are gonna look at you like, wow, he had too much done. So that's the summary of what these treatments are ideal for. I'm gonna pause for a second and talk about what these treatments are not good for. So when it comes to lasers, there's been a lot of marketing hype about non-surgical laser treatments that are designed to lift the face. Trust me, you will not be able to do that effectively, so don't go down that road for the reasons I just mentioned. The changes are deep, and they're the deep fascial layers. Surgery is the only option for that. Non-surgical facelifts are another very common term, especially in non-surgical practices. They become an alternative to the facelift, and we've learned our lesson over the last 10 or 15 years that by putting a bunch of fillers in the cheeks and putting it along the jawline to try to mask the jowling or the descent aspect only makes the face wider looking, bigger looking, very disproportional and very unfamiliar. So don't go down the pillow face route, which can happen as a result of fillers being used as an alternative. Use it as a mild way of treating volume that has already been lost. Okay, so now let's talk about the basics. If you're going down this road of spending money and time and energy on non-surgical treatments to defy aging and try to improve your transition from younger to older, it's super important to keep everything we just talked about in mind and use the right tools for the right things. But when it comes specifically to skin, and I want you to really, really keep this in mind, because when it comes to skin, that is the only area that you actually have total control over the destiny and the aging changes that occur. You don't have any power over volume loss in your face, and you certainly don't have any power over laxity related to facial lengthening, etc. But you have 100% control over how your skin's going to age. So what is the foundational basic things you need to do there before you jump into lasers? And this is a pearl that I want you to keep in mind and really act on. Number one is sun protection, by far the most important thing. If you protect your skin against sun, and if you're lucky enough to be hearing this in your 20s and 30s, you're gonna have a glorious 50s, 60s, and 70s because of this. Sun protection basically means using a broad spectrum sunscreen, using it regularly before you leave the house, putting it on. If you're in a lot of sun, reapply at midday, and that's basically it. That's sun protection. Wear a hat to give you extra coverage. Second component is the use of active anti-aging skincare ingredients that are going to improve the aging of the skin. So basically you want to do things that are going to stimulate collagen, you want to do things that are going to decrease pigmentation production, you want to do things that are going to plump up the skin and bring moisture to the skin. So we're talking about retinol, vitamin C, niacinamide, we're talking about hyaluronic acid serums, we're talking about managing oil production, cleansing the skin properly, all these things. So that is we have a lot of other videos that we talk about this in detail, but remember that skin aging is happening in a complex way, and you need to address each of those changes, because before you start investing all the money on lasers, if you're not taking care of the foundational things, sun protection and daily skincare routine, then the laser changes aren't going to continue to improve. You're just going to improve short term and then bounce back to where your skin was before. And I know for many of you who've had laser treatments, you know exactly what that means, and you've been frustrated by that. But trust me, if you use a laser to elevate to the next level, but you're covering your foundation with a proper skincare routine, you are going to certainly see constant and continual improvement in your skin over time. The key is to be consistent with your skincare and consistent with your the use of it over time. And if you're lucky enough to hear this early, you're going to really, really benefit from this in the long run. And to make things easy, we developed the Karam MD trifecta to basically take all the thinking out of it and just use 3 simple steps that cover the entire anti-aging basis. But that is how you want to address this skin aging aspect of it before you jump into lasers and even think about some of these other things like surgery, etc. So guys, I hope this helped bring perspective in the non-surgical realm of lasers and injectables. So if you enjoyed this, my friends, please hit like, comment below with any questions you have. I will do my absolute best to address the questions that you ask. Hit subscribe if you haven't already. We're going to be pumping out 2 to 3 of these type of videos every single week, so you're going to get lots of good information like this, and send it along to a friend or a family member so they can be empowered and make good decisions for themselves as well. Until next time, Dr. Amir Karam.